things they can do in healthcare, and then their eyes get wide and they don't know where to start and what it means to them. And I think that's where community colleges can help. And like high school counseling, but I think it's more, it's different, right? I think community college can do very targeted conversations with these students, so they're not overwhelmed by getting on that healthcare career path. And then the other piece I think that's critical is, we saw the data and the spread of our programs and how many people that are graduating from those programs, really taking a look at what are some more rare programs that are out there. And I didn't catch on the slide if the surgical scrub tech program is somewhere in the 19, but really looking at what are the hard to fill from the employer perspective, and is there an adequate number of programs out there? To Andy's point, we need all hands on deck and college to produce these allied healthcare providers as well as employers. So is there an opportunity to grow some of those programs in the 19? And the final point, and that kind of ties into, the partnership that we can have as we approach high school students also. As you graduate, some of your allied health professionals, and I'll pick on certified nursing assistants, um, sometimes they need their hand to be held all the way through. We've seen some of those graduate taking a very extended period of time to get certified. And most of us, I believe, require certification. And so then, they get frustrated, but they also get overwhelmed looking for the job, trying to get certified. So, as a new grad from the RN program, I remember my school did a great job in really supporting us through that BRN application process. What is it going to look like? What is it going to take? And, this group of students from different backgrounds may have different challenges around how to get to that finish line.
I think everyone here made excellent points throughout the panel discussion. I really appreciate you all. And I now want to open it up, maybe go until 11:55 for the guests to ask any questions directly to our panelists. I know I saw in the chat a few questions by David, as also Jermaine, and I think Tiffany. So if you guys can raise your hand and then unmute, that would be great. And then you can address your question. Jermaine, I see your hand first.
Beat everybody to the punch. Thanks all. Thank you all. Great presentation today. Really appreciate all the comments and the interaction. I just had really one question. I did put it in the chat. I think overall, what we're seeing, at least from LADC research, is really in terms of housing costs. With our housing costs here in affordability and across all of LA County, it's very high. So one, are you losing talent? Are you having a trouble retaining talent? And what are some thoughts and solutions there? And then the other kind of part to that is obviously the impact of the wildfires. We have some data that's coming out and going to be doing a regional analysis. Have you had any impact from the wildfires in terms of workers as well?
I can try to answer this question. To be transparent, it definitely does have a big effect. When they hear, oh, LA, you're trying to recruit some high level folks or just folks in general from other parts of the state or other, just other parts of the nation. It's hard to kind of speak to the housing costs. That's where we have to kind of come in and share all the other offerings that come with being a part of a large, academic medical center, all the benefits, all the professional development. That's where we come in as employers to really highlight all the other great things that offset the housing costs. I know sometimes it does come down to the bottom dollar, but I think if a candidate can holistically look at what kind of the organization can offer in terms of stability and growth, I think those are things that a candidate needs to really think hard about. The fires did affect us also. I mean, I can tell you all, we had some candidates in the middle stages and they were like, oh, maybe we'll just pause. I'll just pause my candidacy for now. So that did have an impact, sadly. But, you know, I think we just have to move forward strategically in how we market ourselves to the workforce. The one thing I do want to point out is we are a very heavy union environment. A lot of the roles that we are talking to now, a lot of the roles that some of your students are looking at in the clinical space are part of unions who fight really hard for fair salary wage increases year to year and really strong contracts. So being a part of a health system that offers that kind of protection and advocacy for them, I think hopefully they can see that they are very much looked after in that sense. So.
Thank you. And I put a couple reports in the chat. Thanks all.
Hey, Jermaine, this is Andy. So, you know, when I started working in human resources 35 years ago, I had no idea that my day job would include international relations. So, you know, that's part of the job now, is trying to navigate, you know, the challenges faced, and housing and urban development. And so it is a real, very real issue. I'm so glad that you brought it up. You know, yes, you know, very quickly, we're very much impacted by the wildfires for sure. Luckily, we did not have any of our folks who have lost their home. None of them have resigned. We have found ways to help support them in that. But it continues to be a very real issue, especially for our allied health professionals. So those individuals who are paid well, but still on the lower end of the economic spectrum. And so what is it that we need to do? So if any of you haven't, and I'll happily read the reports that you sent, because and look for anything else that you send out, because this is a very real issue that we have to deal with other agencies and other you know, I'm sure you have peers in other parts of you know, the work that you do who address the housing issues, but it's very, very real. And we need all good ideas are welcome. I'd love to hear any.
Absolutely. Thank you, Andy.
Yeah, thank you, Andy, and thank you, Joanna. I see, Armando, you have your hand raised.
Yes, thank you so much. Well, good morning, everyone. This is Armando Rivera, Associate Vice Chancellor for Workforce, Los Angeles Community College District. Thank you so much, Lark, for putting this together. Very, very helpful. And thank you so much to all the panelists. So I have two questions. The first one is if you could talk to us about what programs are available to help enter into the professions students with disabilities, different disabilities. That's one of our targets, to increase that population. And number two is the reality. We do need clinical sites. We do not have clinical sites. We are competing with the private sector. I have colleagues that have been kicked out from hospitals right now. I have colleagues that have been switched from Thursday 8 to 3 to Sunday midnight to 6 a.m., which becomes a social injustice of the social justice movement. And, that's a bigger conversation. And I think that we're almost out of time, but I want to make sure that these two questions were posted. And again, thank you so much, guys.
Thank you for that, Armando. I think the question is there an opportunity to partner up for potential sites there, clinical sites? If so, I mean, I think we'll follow up anyways, but I don't know if anybody has any additional input there.
I'll jump in, start the ball rolling here. But so I know that the challenge that we face is we would love to have everyone and all programs, be here, because we know that obviously it's a feeder for us. The problem is we don't have enough preceptors and people who can help do that work. I mean, it's just, you know, when we're having to cut, you know, $80 million a year in order to keep our heads, you know, above water with all the reimbursement challenges and Office of Healthcare Affordability and all those issues that are happening right now. You know, those individuals that were a preceptor yesterday might have to be back on the nursing floors, right? You know, caring for patients. So I don't have a good solution for that, but would welcome all ideas because I understand exactly where you're coming from and the pain that you're experiencing because you don't have a place to send your students. And I just don't know of a good solution. Maybe fixing the reimbursement process. I'm joking. You know, it's something.
Right, exactly. That was
Than any of
that
these.
was funny.
Yeah.
I was
Yeah.
like, what?
You know, if I may just add one idea, is something that I have done in the past. And by the way, we feel for you from the employer's perspective, because it's exactly what Andy said. If we could get all the students, because it's kind of like benefits you to benefit us, right? So it's the proverbial, right, chicken or the egg. But it was one good strategy, Andy, I've implemented in a past life, my hospital experience. We've actually hired a nurse. She was an instructor in one of the colleges, and she would pick up a shift here and there, but really her full-time job was the precepting and taking care of students. And so we've then lowered that pressure, right, on the floor nursing and the preceptors and the clinical education department. So I think partnerships like that, where these solutions are being, you know, shared, they're maybe a little bit out of the box, right? But there are solutions that I think you know, it's a possibility. Another one, this is probably now 12, 15 years ago. We've actually gotten some of the local hospitals at the time in Glendale and Pasadena to pitch in for like a preceptor person. So we paid salaries. We split, and then that person was actually rotating, right, within the hospitals and all that. So it's just kind of getting us to think outside of the box and deliver and you know, provide some of that collaboration up front. I think would be very helpful outside of these traditional solutions, because to your point, you know, it's really tough for the employers.
No, those are great innovative ideas, and I think to the importance of also working cohesively here as employers to solve the bigger issue is also very important. So appreciate that, Armando. Thank you for the question. Just to respect everyone's time, we'll close it out with final remarks. So just going back to my notes, some key components of what went over during this discussion is one, the ability to make sure that our students have the technical skills that they come within the component of business ready within healthcare as well, patient-centric care as well, understanding data analytics, and then just, again, building that future professional all around. We also some obstacles that you mentioned, which are time and resources to upscale your current workforce. And then some current trends that we see and that are here to stay is telehealth, as well as AIs here. So a lot of room for opportunity to partner up. I know Dr. Militovich mentioned the opportunity to create more certificates that are a little faster to complete. And again, going back to the overall main component that I think was addressed by all of us here is the need for those soft skills to continue to grow. So appreciate all the panelists. Again, I think it was a great conversation. I want to allow Dr. McKeegan and Jermaine for any final thoughts. But on my end, I thank you so much. It was a pleasure speaking with all of you. And then I'll allow Dr. McKeegan for any final remarks.
No, just a lot of gratitude and appreciation. Thank you so much. This has been wonderful. We have a lot of work to do together to help support not only the industry, but also to ensure that our talent has opportunity. As you could see, we have a diverse group of talent that need these opportunities. So we look forward to continuing this discussion and finding solutions together, because that's the only way we're going to be successful. So much appreciation to our industry partners, LAEDC, as well as our LA19 colleges that are on the call today. Thank you so much.
Thank you, Dr. McKeegan. Jermaine, any last remarks?
Nothing from me. Dr. McKeegan said it all. And so just looking forward to the follow-up, looking forward to the partnership. Thank you to all the faculty that are on the call, and then obviously our wonderful partners for taking time out of the day to speak to us. And so I'm looking forward to continued collaboration. Thanks all.
Thank you. We will follow up with the email, the recording, and then as well as the lookbook. Thank you, everyone. Have a great rest of your day.
Absolutely. Thank you.
Thank you.